Hey guys, Dr. Ross here with Shirley Eye Care. So February is Macular Degeneration Awareness Month. So macular degeneration, or AMD for short, is one of the leading causes of vision loss in individuals over 50. Now a lot of you may be wondering what exactly is AMD. So AMD is a wearing out or a deterioration of the central part of your retina known as the macula. Now the macula is what allows us to do anything that requires detailed vision. So whether this is driving, reading, or even recognizing faces. So while vision loss from macular degeneration doesn't cause total blindness, we still preserve our peripheral or our side vision. We can see that with the loss of our central vision, day-to-day activities can get quite disrupted. Now there's two main types of the disease, the dry form and the wet form. The dry form is much more common, usually makes up about 80 to 90% of the cases. The wet form, as the name implies, usually involves bleeding that can occur within the eye and is more associated with severe vision loss. Now, the biggest question we get is, am I at risk for AMD? So we have a lot of people that come in asking, they have a family member with the disease. Does this mean they're going to get it as well? Genetics do play a large part in the disease, and it can increase your risk for getting it down the road. But there's a number of other risk factors as well, which are mostly things that we're able to control. So some things to keep in mind. We want to try to maintain a healthy blood pressure and a healthy body weight. We want to try to stay active, exercise as often as possible. We want to try to maintain a healthy diet and get in as many leafy greens as you can. Some other things to remember: you want to avoid smoking, try to use UV protection whenever possible. Now, like we discussed earlier, vision loss typically doesn't occur till later stages of the disease. So for earlier forms, really these are only going to get picked up throughout the course of your eye exam. So again, that drives home the point how important it is to come in yearly for a dilated eye exam. So if changes are noted in your exam, usually the next step is we'll get what's called an OCT test. So this lets us get an x-ray of the inside of the eye to look through all the individual layers just to see what kind of changes are occurring. So depending on the OCT, depending how things look, will determine how often we'd like to see you back. Usually we'll send you home with one of these as well. This is what's called an Amsler grid. So this just lets you check your vision at home to see if any changes are occurring. Now, as far as treatment options go, unfortunately, there's no cure for AMD at this time. However, there are treatments out there that can slow down or decrease your risk of progressing to one of the more severe stages. These are usually determined by the stage of the disease that you're in. So for early forms, really no treatment's recommended. Best practice is just to try to minimize those risk factors we discussed earlier. For more moderate forms of the disease, supplements are available that are shown to decrease your progression to the more advanced stages. With these supplements, it's always best to consult your eye doctor first to make sure you get the formula that's right for you. And with the advanced or the wet form of the disease, the most common treatment at this time is usually in the form of injections. With these, the medicine is actually placed inside the eye to stop or slow down that bleeding. For this, typically we'll send you out to a retinal specialist in the area that will take care of this for you. So the biggest take-homes from today is if you're someone at risk for the disease, try to minimize those risk factors. And for everyone else, make sure you're coming in for your annual dilated exam. All right, hope to see you soon.